Tortposia, or I think it's probably more well known, a more scientific term, maybe, or descriptive term, I should say, is it like a room tilt illusion? And basically, it's often a sort of transient phenomenon that basically patients' sort of environment, that visual spatial perception of their environment tilts on its axis. Classically, in the sort of coronal axis, 180 degrees. And it all relates to a problem of patients' perception of verticality, which is inputted from lots of three main systems: your visual, proprioceptive, and vestibular systems. And when there's a problem with one of these three areas, so you can have the localization can be in one of those three areas, you get a cortical mismatch. This three-dimensional map that the cortex generates from these three areas gets mismatched and causes this phenomenon. This is different to what more of a subjective vertical tilts or visual vertical tilts you can get are more associated with vestibular dysfunction specifically, and classically are involved just torsion of a few degrees. Now, imaging or a picture or the descriptor is probably more useful for this context, and there's a really nice article, almost 10 years old now, but it was done by some radiologists looking at this problem, and this gives you an idea of the sort of three main ways in which room tilt illusion kind of happens. On the bottom left there, that's your sort of classic 180 degrees in the coronal plane, and the one in the middle there is 90 degrees, and then another one that you can see less commonly is sort of 90 degrees upwards in the sagittal plane. So I thought it's just a nice, useful diagram showing it. So what does it mean, and what's the clinical relevance of it all? Because obviously the difficulty is the differential is really, really wide. And obviously it can be from vestibular problems, stroke, migraine, some very rare forms of tumour can be associated. I think in all contexts, if someone presents kind of acutely with this, and often an acute or subacute presentation, the main concern is a posterior circulation stroke and SCA or tertiary infarct. Though often one would expect in that context to have associated sort of features, nystagmus and ataxia, truncated ataxia, etc. Obviously, vestibular causes, in terms of the clinical history, you tend to be expecting a positional trigger to be associated with that as well. Obviously, migraine as well. And with the patient I'd seen had sort of quite urgent structural imaging, including MRI, but she had a headache and some other sort of sickness with it, and so it sounded more migrainous when I'd seen her. But actually, sort of studies have shown, the limited studies that have been, there are a high proportion of these patients with sort of tortopsia symptoms that do have posterior circulation strokes. So it has to be something very much in our mind. So when we think about assessing these patients, it's very much about ruling out those pathologies, and obviously thinking of the clinical history and where that ties you more. So yes, that was hopefully, I didn't want to say much more. I think that short and sweet is mainly just to focus on an interesting clinical sign I'd seen and the clinical relevance and what pathways it should put you down.